Hello everybody, welcome to Adulting 101. My name is Maani. I am here to talk with you about Medicaid. Did you know that millions of young adults are covered by Medicaid, and depending on which state you live in and your income, you might be eligible for Medicaid as well. So, first question is, what is Medicaid? Basically, Medicaid was created under President Johnson's Great Society as a health insurance program for low-income individuals. It was also created at the same time as Medicare, which is not to be confused. Medicare is health insurance for the elderly. Medicaid is a joint funded program from both the federal and state level, meaning the eligibility can vary from state to state as well as the name can vary from state to state. An example of this includes California, where they call their program Medi-Cal, whereas in Arizona they call it Access. Traditionally, Medicaid only covered low-income children and pregnant women, as well as blind and disabled individuals. But after the passage of the Affordable Care Act, eligibility has been expanded to cover more low-income individuals, including adults without children. But this expansion does not apply in all states. The Supreme Court ruled that since states share ownership of the Medicaid program, they should be able to choose whether or not to expand eligibility. As of right now, 36 states and Washington, D.C. have chosen to expand Medicaid, covering 12 million additional individuals. The 14 states that haven't expanded still have the option to do so down the road. As of October 2018, 73 million people get their coverage from Medicaid. Okay, so now we've talked about who's eligible. Let's talk about what services are covered by Medicaid. Services can vary from state to state, but a few are mandated across the board, such as inpatient and outpatient hospital and doctor visits, as well as some additional important services. In addition to that, states can opt to include additional services such as dental, vision, prescription drugs, or certain services for individuals with disabilities. So you might be wondering, what does Medicaid cost? And the answer is the price varies from state to state. While Medicaid can cover 100% of some services, states can choose to implement out-of-pocket costs, such as premiums or co-payments, to certain populations, but might not apply to all enrollees. It's important to note that not all providers accept Medicaid, so you always want to try to call ahead before you go to make sure that they accept Medicaid. Lastly, you might be wondering, how do I apply? If you're uninsured and think you might be eligible for Medicaid, go on to healthcare.gov to fill out an application. Even though the marketplace open enrollment period has ended, Medicaid enrollment is year-round. And if your state hasn't expanded, check out younginvincibles.org for more information on how to bring affordable coverage to your home state. Still have questions about Medicaid? We're here to help. Drop a comment below or email us at digital@younginvincibles.org.